The United States has officially withdrawn from the World Health Organization, ending nearly 8 decades of membership. This decision marks a major shift in American global health policy and international diplomatic engagement. The withdrawal became official after a 1-year notice period required under World Health Organization rules. The process began in January 2025 following an executive decision by President Donald Trump. US officials confirmed the exit through statements from the Department of State and Health Department. The administration cited long-standing concerns over the World Health Organization's leadership, transparency, and crisis response. Officials specifically referenced the organization's handling of the COVID-19 pandemic as a core justification. They argued the WHO failed to act independently and lacked sufficient accountability during critical early stages. The United States was previously the World Health Organization's largest financial contributor. American funding accounted for roughly 18% of the organization's total operating budget. That funding supported disease surveillance, vaccine coordination, and emergency outbreak response worldwide. Public health experts warned the withdrawal could reduce US access to global disease monitoring systems. Those systems help track emerging virus variants and inform vaccine development inside the United States. Experts say infectious diseases do not respect borders, making international coordination essential. Without WHO membership, the US may rely on bilateral agreements and alternative data sharing arrangements. Administration officials argue those alternatives can replace multilateral structures more effectively. They claim the United States can still cooperate globally without formal WHO membership. The World Health Organization expressed regret over the US decision. WHO leaders warned global health security depends on broad international participation. Several allied nations voiced concern about reduced American leadership in global health efforts. Health advocates warned the move could weaken programs targeting polio, tuberculosis, and pandemic preparedness. Critics say the withdrawal risks creating leadership vacuums other global powers may attempt to fill. China has publicly reaffirmed its support for the World Health Organization. That contrast highlights shifting influence within international health governance institutions. Legal scholars have questioned whether the withdrawal bypassed congressional authority. The United States originally joined the WHO through legislative approval in 1948. Supporters of the decision argue it restores national sovereignty over public health policy. Opponents counter it reduces American influence over global health standards and emergency responses. Several unpaid US financial obligations to the WHO remain unresolved. Those outstanding payments could affect future cooperation between American and international health agencies. Looking ahead, key questions remain about data access and outbreak coordination. Another concern is how developing nations will manage without major US funding support. Public health officials warn weakened global systems increase risks for all countries. Future pandemics may test the effectiveness of fragmented international health cooperation. The US withdrawal represents a defining moment in global health diplomacy. Its long-term consequences will shape international disease response for years to come. This story continues to evolve as governments reassess global health partnerships. We will continue tracking the impact of this decision on public health worldwide.